Hi guys, welcome to Plasma. So today we're going to discuss poisons and their antidotes, right? So first is acetaminophen, that is the paracetamol. Okay. So its antidote is acetylcysteine. Okay. Acetadote and mucomist, right? So it best results if given 8 to 10 hours of overdose, 8 to 10 hours of overdose, right? Now follow liver function test. You have to do the LFTs and acetaminophen blood levels. You have to check the blood levels of paracetamol. Okay. Now this acetadote, it's given intravenously, right? And mucomist is given orally. Okay. Now anticholine esterase intoxication. Okay. Organophosphates, carbamates, right? Its antidote is atropine, right? So useful to control muscarinic symptoms. Now it is of no value in delayed onset of mushroom poisoning. Okay. So next is membrane depressant cardiotoxic drugs. Membrane depressant cardiotoxic drugs. Okay. Like tricyclic antidepressants. Okay. And quinidine, etc. Right. So its antidote is bicarbonate sodium, bicarbonate and sodium. Right. Now you have to give this 1 to 2 milli equivalent per kg IV bolus. Okay. Now it usually reverses cardiotoxic effects, right? Those are wide QRS, hypotension, okay, hypotension, and it is to be given cautiously in heart failure and avoid sodium overload, right? Next thing we'll talk about fluoride and calcium channel poisoning, okay, and calcium channel blockers, okay. Now the antidote is calcium only, okay. How is it given? Large doses may be needed in severe calcium channel blocker overdose. So start with 15 mg per kg IV, right? Next, we'll see iron salts poisoning, right? So for iron salts poisoning, the antidote is deferoxamine, Okay. So if the poisoning is severe, give 15 mg per kg per hour IV. Okay. Now there is this important thing that 100 mg of deferoxamine. Okay. It binds to 8.5 mg of iron. Okay. Now next, digoxin and related cardiac glycosides poisoning. Digoxin and related cardiac glycosides poisoning. Okay. So the antidote here is digoxin antibodies, right? So one vial binds 0.5 mg of digoxin, right? Now the indications are serious arrhythmias, okay, and hyperkalemia, right? Next, poisonings by theophylline, caffeine, and metoprolol, okay. So the antidote here is esmolol, right? So esmolol is a short acting beta blocker. Okay. Now you have to give infusion of 25 to 50, 25 to 50 mcg per kg per minute IV, right? Next, methanol and ethylene glycol poisoning. Okay. So the antidote here is ethanol, right? So first, a loading dose is calculated so as to give a blood level of at least loading dose is calculated to give a blood level of at least 100 milligram per deciliter, right? And 42 gram per 70 kg in adults. Okay. Now fomepizole. Okay. It is easier to use in methanol and ethylene glycol poisoning, right? Now this poisoning by benzodiazepines. So once you visit the emergency medicine department, you'll see a lot of patient who overdose on these, and the antidote for this is given flumazenil, right? So you'll come across a lot of patients who come with benzodiazepines overdose, and flumazenil is given. So the adult dosage is 0.2 mg IV. Okay. Now it is repeated to reach maximum of 3 mg. Now the contraindications, it's very important. Okay, do not give to patients with seizures and benzodiazepine depressant dependence or tricyclic overdose. Okay, so the contraindications are equally important. Next, we'll talk about again methanol and ethylene glycol. This is also a very common case in the emergency medicine department. So the antidote for this is more preferred fomepizole, right? And it is more convenient than ethanol. So it is given 15 mg per kg. Now repeat every 12 hours, right? 15 mg per kg, repeat every 12 hours. So next, if there is beta blocker overdose, okay, then the antidote is glucagon, right? 5 to 10 mg IV bolus, okay, and it may reverse hypotension and bradycardia, okay. Now this is a very important poison, cyanide poisoning, right? So its antidote is hydroxycobalamin, right? Now the adult dosage is 5 gram IV over 15 minutes, okay. Now this converts cyanide to cyanocobalamin, cyanocobalamin, right? That is the vitamin B12. Okay, this is also important. Next, narcotic drugs and other opioid derivative poisoning. Opioid derivative poisoning. Okay, so the antidote here is naloxone. Okay, so this is a specific antagonist of opioids. Okay, so you have to give 0.4 to 2 mg initially, 0.4 to 2 mg initially, right? By IV, IM, or subcutaneous injection, right? Now the larger doses may be needed to reverse the effects of overdose with propoxyphene. Okay, larger doses may be needed to reverse the effects of overdose with propoxyphene, right? Codeine or fentanyl derivatives. Okay, carbon monoxide poisoning. Now you might have heard in hilly areas where people who burn firewood and close the room and sleep there, in the morning they are found dead because of carbon monoxide poisoning, right? So the antidote for this is obviously oxygen. right? So you have to give 100% oxygen by high flow non breathing mask. Now, for delirium caused by anticholinergic agents, right? So the antidote here is physiostigmine. Okay. Now adult dosage is zero point 0.5 to 1 milligram IV slowly. Okay. Now the effects are transient only to 30 to 60 minutes. Now this may cause bradycardia, increase bronchial secretion and seizures, and have atropine ready for reversal of these effects. And do not use physiostigmine for tricyclic antidepressant overdose, right? Now organophosphate, this is also very common and very frequently asked in every subject like forensic medicine and or pharmacology or medicine, okay, or cholinesterase inhibitors, right? So the antidote here is pralidoxime. Okay, this is an oxime. Okay, that is 2 pam. So the adult dosage is zero point 0.5 to 1 mg. Sorry, the adult dosage is 1 gram IV. Now it should be repeated every 3 to 4 hours. Okay, or as a constant infusion of 250 to 400 milligram per hour. Okay, and this is also important, the pediatric dose is 250 mg, right? So these were some poisons and their antidotes. Thank you.